of give and take. And the early signs are that one of the areas of the US wants us to give way on is pharmaceuticals. Politicians in the UK are worried about this, not least Andrew Lansley, the former Health Secretary, who expressed his concerns in the Lords today. But how much of an impact would it really have? Well, Newsnight has spoken to experts who are concerned that if the US gets its way on a trade deal, it could lead to the NHS's branded pharmaceutical bill being more than doubling. Deborah Cohen reports.
Around the globe, the pharmaceutical business might be about to get a whole lot more transparent. And who would argue that isn't a good thing? Well, that depends on what you think it means and in whose interests it's working.
Battling with the spiralling cost of medicines is a preoccupation of governments around the world. Newsnight has reported recently on several cases of the NHS facing prohibitive costs. Opaqueness of the pharmaceutical market means it's very hard for countries to know if they've got a good deal compared to another.
What most buyers need is to see the bigger picture.
Medicines prices can vary a great deal between countries. Sometimes prices are much higher in wealthier countries and much lower in poorer countries. There can be price differentials of over 100 or even 200-fold for the exact same medicine. But there is no systematic worldwide approach to pricing medicines, so sometimes we see the opposite, actually, where poorer countries will end up paying more than richer countries. When governments or health insurance companies, for example, don't have much information about how prices are set, what other countries are paying, or what it costs to develop or manufacture a medicine, they are in an even weaker negotiating position. And so we have a situation where the power imbalance is already significant, and it's just made worse by the increasing confidentiality and secrecy that we see in pharmaceutical markets.
This power imbalance has had the World Health Organization concerned. At its recent annual meeting, the way ahead.
The resolution was quite controversial. I would say it was probably the single most important and controversial issue that was discussed at the World Health Assembly this year. It calls for much more transparency in pharmaceutical markets, that the public should know, for example, what are the prices being paid, how long can we expect a monopoly to last, what does it cost to develop a new drug.
But the issue of transparency can cut both ways. President Trump wants to use it to get others to pay more for American drugs.
It's unacceptable that Americans pay vastly more than people in other countries. I am asking Congress to pass legislation that finally takes on the problem of global freeloading and delivers fairness and price transparency for American patients.
So with the UK hoping for a trade deal with the US, could our drug prices actually go up? It's easy for politicians to say the NHS is not on the table in a negotiation. But listen to this from Prime Ministerial hopeful Jeremy Hunt.
Now, that's not to say that, pharmaceutical products, drugs, those kinds of things which are freely traded between countries couldn't be discussed.
A trade deal is a big, influential lever for the US, one it's not afraid to pull.
I've already met with Ambassador Lighthizer, the U.S. trade representative, and he's working on strategies on how we could take this to our trading partners who ought to be paying more and use the full weight of the U.S. government's trading power to try to get them to pay more.
The US has published a document setting out its objectives in a US-UK trade deal. It's not a big document, but it does contain a brief section about the pharmaceutical industry.